Hey everyone, welcome to Lab 1 of AHCJ 250. We'll be covering the skull. In this first video, we're just only going to be looking at the first few pages of our lab notes. The purpose of this video is just for you to practice labeling your notes. We'll actually be going through page by page all of your lab notes over the course of this class, and we'll be labeling them. So I would encourage you to print off your notes and grab some crayons or colored pencils and actually color along with me. You don't have to. You're not going to be turning this in or anything like that. But I do find that the practice of actually seeing me label it and then copy that onto your paper and actually draw it out, it helps you have a better understanding of exactly where these structures are, and then it kind of serves as a reference for you when you study. And again, these are just sketches, as you can see. It's not the most realistic photos here. We're going to be doing something very similar to this on more realistic models later. The purpose of this really is for you to print out and label along with me. So please do it. I don't think you'll regret it. So the first bone we're going to be talking about tonight is your frontal bone. There's not a whole lot to the frontal bone. There's only two structures on it. I'm going to go ahead and outline it right now. There it is. I'll put that same color next to the title so you know what that is. Let's also label the structures. If you see this piece of the frontal bone, it sort of juts out, sort of where you would expect your eyebrows to be, right in between your eyebrows at least, is the glabella. You'll see a few other angles of that when we do our other videos. For now though, just go ahead and label it. Now this next structure, the zygomatic process, is actually a bit complicated, especially for our very first slide, but we're going to go ahead and label it. It's right here. It's above this black line. So at this point, we're actually done with this slide. I'm going to show you guys some more things. You can draw this if you want. I think your picture might start to get a little cluttered, but it's up to you. I'm going to label several other structures here. I'm running out of colors. Alright, so I've got a few different things on here. You can probably see that there's a black line in between each of these pairs of color. That black line is a suture. It's actually a joint between the two bones. And then let's take this a step further and talk about all the bones that we're discussing right now. So we have the frontal bone, we already know. Here's a temporal bone, which we'll learn about later. And here's a maxillary bone that we'll learn about later. And then lastly, we have the zygomatic bone. So there's 4 bones here, and we've now done some drawing around each of these bones' connections with the zygomatic bone. So this blue area is a piece of the frontal bone that touches the zygomatic bone, so it's called a zygomatic process. But guess what? This red over here is the piece of the temporal bone that touches the zygomatic bone. It's called the zygomatic process too. And then this gray area is a part of the maxillary bone that touches the zygomatic bone. It's also called the zygomatic process. So when we're answering questions on a quiz or a test, we actually need to be a little bit more specific. So if this blue structure was tagged, you would say zygomatic process of the frontal bone. If this red structure was tagged, you would say zygomatic process of the temporal bone. And if this gray structure was tagged, you would say zygomatic process of the maxillary bone. Now, to make it a little bit more confusing, and don't worry because we're going to talk about each of these on slides farther through this video, but it works in reverse as well. So this purple structure would be the frontal process of the zygomatic bone. The yellow structure would be the temporal process of the zygomatic bone. And this green structure would be the maxillary process of the zygomatic bone. So if that doesn't make a ton of sense, don't worry. Right now, all you're responsible for knowing is this blue structure right here. That is the zygomatic process of the frontal bone. This whole bone is called the frontal bone, and then this little piece in between where you'd expect your two eyebrows to be is called your glabella. Let's move on to the parietal bones. So all of the structures here are sutures. It was just a good place to put the sutures because the parietal bone doesn't really have much of its own structures that we're going to cover at least. So we've sort of assigned these sutures to parietal bones, but in reality, sutures are joints between two bones. They're really strong joints, or fibrous joints that are not designed to move at all, but they are technically joints. So we could have put these with the temporal bone or the frontal bone, but we put them all here. There's another video that you guys should have watched by now that talks about anatomical position, directional terminology, and planes. So this first suture, actually the first two sutures, are named for the plane that they're in. So if you remember, the frontal plane could also be called the coronal plane. This suture is in that plane. There it is. You can also see it from the anterior view. I'll do a red line. The sagittal suture is in the sagittal plane. So you can see it much better from the posterior view. In this photo, you can also see a little tiny piece of it right there in the sagittal plane, so we call it the sagittal suture. Now, I don't actually know my Greek alphabet very well, but if you were in a sorority or fraternity, you may. I know alpha and beta, and then I start to lose track, but I do know there's a letter called a lambda, and it looks like an upside down Y, which is where this particular suture gets its name. And that is the lambdoidal suture. There it is in yellow. Our next suture is called the temporal or squamosal suture. I prefer temporal for obvious reasons. So let's go ahead and draw that in. It basically defines the boundaries of our temporal bone, which we will name and cover later, but there it is, temporal suture. You can label that however you want. And you see that from the side. And that is it for our parietal bones. Now we have our occipital bone. Our occipital bone sort of forms the base of our skull. It's the bone that actually sits on our C1 vertebra. It also extends quite a bit up the posterior aspect of the skull as well. So if I would put an X right here, that is on the occipital bone, but I can also put an X down here. This is also occipital bone. Oops. So let's go ahead and start naming some of these structures. I'm going to put an X here. This is our inion process. You can actually probably feel it on your own head. If you put your hand on the back of your skull, there's a little bump, kind of midline, central, posterior aspect of your skull. That is your inion process. It's resting on a line here called your superior nuchal line, which is just above the inferior nuchal line, which makes sense based on their names. So we have a superior nuchal line, inferior nuchal line, and inion process. Now we have a very large foramen. A foramen is a hole in bone right here. This is where your spinal cord exits your skull, and that is called your foramen magnum. Now on either side of that you have a structure called the occipital condyle. It sort of looks like a little kidney bean. And I'm actually going to draw in the boundaries of the occipital bone. I forgot to do that earlier, just to give you an idea of what bone we're talking about here. There it is, and again in orange, that is your occipital condyle. That's the part of your skull that actually rests on your vertebral column. And if you were to nod up and down right now, like you're saying yes, that would be where the motion would be occurring. That condyle would be rocking back and forth on your C1 vertebrae. Let's use green, I guess, here to highlight this region in front of the occipital condyle. That is called your basilar portion. And this next structure is pretty tough to see. It's actually probably easier to see on here than on a real skull. Right in the middle of basilar portion is your pharyngeal tubercle. I kind of overdid it there. It's just a tiny little dot. Right there, you can kind of see it there. And then lastly, you can't see this structure on these notes, but we'll be able to see it plenty on our other videos. Right about here, if you were looking from the front, almost like you were looking through the mouth, you'd be able to see these two little perfect circle foramina, one in front of each occipital condyle. That is called your hypoglossal canal. And that's named for one of your cranial nerves, cranial nerve 12. It exits there and innervates some muscles that are responsible for making your tongue protrude. So if you stick your tongue out, you're using that nerve which passes through that canal. And that is it, you guys, for this first video. There will be quite a few more for the skull. There's a lot going on in the skull. It's pretty lengthy. It's good to get it out of the way in this first lab. So thank you for following along, and I will see you in the next video.